Good morning, everybody. We will start this roundtable. I hope everybody can hear me well. So today we are going to talk about promoting inclusiveness throughout the data cycle. And for this presentation, we have 4 speakers with us. So we have Rikke from ECHO, Dan Burwood from Integrity Action, Marie, who is an international consultant, and Jerusha from the South African Monitoring and Evaluation Association. And myself, Florian Pujol, I'm working at Humanity and Inclusion, that you may also know as Handicap International. And I'm the head of the Information Management Unit. So working on information management for the operations and all around the world for HI, and I'm based in France. So maybe I'll let the speakers quickly introduce themselves. So Rikke.
Yes, good morning, everyone. Can you hear me?
Yes.
Great. Hello, so I'm Rikke Fredberg. As the text says, I'm a policy officer at DG ECHO in Brussels and in Unit C1, which works with humanitarian aid thematic policies. I mainly work with protection, vulnerable groups, and particularly with people with disabilities. I will be speaking about gender and age today also because my colleague was not available. A bit about my background. Before I came to ECHO, actually just 2 months ago, so I'm very new to ECHO. I worked at the Danish Ministry of Foreign Affairs, Danida, in the humanitarian department, also covering protection and vulnerable groups, and some partnerships and some crises also. So that is a bit about my background. Really looking forward to this session, which I think will be very interesting. Thank you.
Dan, can you go next?
Sure, I was just trying to get my video started. Hopefully you can hear me. So yeah, I'm Dan Burwood. I work for Integrity Action, which is a UK-based NGO focusing on the field of social accountability in the broad sense. I'll talk a little bit more later, I guess, about the details. Yeah, so we're quite small. I'm based in London. So my role at Integrity Action focuses on the whole range of monitoring, evaluation, learning, a bit of research, that kind of thing. So it's not as explicitly on issues of inclusion as maybe others on the panel, but we have a gender equality and social inclusion strategy, which I think applies to us all. So yeah, I'm really looking forward to it.
Marie?
Yes, do you hear me?
Yes.
Okay, perfect. So good morning, everyone. I'm consultant for international NGOs, currently for Première Urgence International, based in France. I'm a specialist in humanitarian gender, feminist integration, specifically the vulnerability of women and gender minorities in emergency situations and protection of population in crisis. I'm also a board member of Médecins du Monde France, and for this forum, I would bring a programmatic vision and field issues, and will focus my presentation around 3 points: the importance of inclusive data protection protocol and risk management system, gender focus, and mitigation measure that can be used in sensitive context. Thank you.
Hi everyone, I'm Jerusha Govender, and I'm from a company called Innovator. I've worked in an M&D role as an M&D specialist for just over a decade, mainly in Southern Africa, in building the capacity of organizations to implement M&D systems or develop information in M&D systems. My particular focus and passion is around data communication, which is really around like how do you take M&E information and actually make that accessible and useful. So in 2015, I started a socially conscious business called Innovator. So I am the founder. And yeah, our work is particularly around using innovative approaches to data communication and data collection and supporting development organizations to utilize this. I'm also a legacy board member of the South African M&E Association. Thanks.
Thank you to all. So before we start actually the roundtable, just a quick reminder. So for all the people attending, if you want to interact, you can use the chat, and please use the option with everyone and the panelists. You can also use the Q&A option, so you can put some questions. You can also see the other questions and vote for the questions, and we will take the questions at the end of the session. So we have 1 hour and a half, and we won't be able to go over time because there is another session starting just after, so we would have to be on time. During about now the next 40, 50 minutes, we are going to each of the people that have just presented themselves are going to speak, to present about one specific topic, and then we will have at least half an hour for Q&A. So if you have questions, don't hesitate to put them in the Q&A, and we will answer at the end of the session. So just a quick introduction to this topic, which I think is a bit complex, at least when looking at the title, Promoting Inclusiveness throughout the Data Cycle. The first thought I had was, wow, that's not a very easy title. It's not so clear. So I just wanted maybe to explain my understanding of this topic, and then I will let the others speak. So first thing is, in this title is the data cycle, which I'm sure most of you already know, but maybe it's going to be a good reminder for some other people. So this is HI's version of the data cycle. I guess there are as many versions as organization, each one has its own version, but basically the main steps are always the same. Sometimes they are split in two, sometimes some of them are merged, but it's all in all, it's globally the same. So the data cycle usually starts with identify and decide. So if you are going to collect some data, you need first to ask yourself, why am I collecting this data? What for? What am I going to do with it? What kind of data do I need? So that's the first step. And then you plan your data collection. So you wonder, is it quantitative or qualitative data? Am I going to use mobile data collection or paper? If it's if I'm going to conduct a survey, how do I get my sample? What is the technique used? And what are the tools that I need to use? So this is all the planning of the data collection. So there is a lot of work to do before actually starting the data collection. But then you go on the field and you collect your data, or sometimes even you don't even need to go on the field. You can remotely collect your data. Then once you have your data, you clean it, you process it a bit, and then you can start to analyze and interpret your data. And then comes the final step, which is, in my opinion, the most important one, is to share and actually use the data, because that's what we do all these previous steps for. It's to actually be able to use the data, and in the same time, you can archive it and pull it. So as I said, this is one version of the cycle. There are different ones. I also like this one, and I saw that Jerusha is going to use it also. Because this one, it's not a cycle, it's presented as a chain. And if you have a look at it, the steps are more or less the same, but this one puts more emphasis on the use of the data. The one I presented before, maybe it was stronger on the preparation of the data collection. This one really insists on the use and the uptake and the impact. So that's why I like it too. So just to put into context, what is the data cycle? And then we are talking in the title about inclusiveness. So inclusiveness, and this is, again, this is HI's definition, but I guess it's more or less, well, we can discuss it if some are. Okay, sorry, my connection cut a bit. Can you still hear me?
Yes.
Okay, I guess I need to share my screen again, right?
Right.
Okay, sorry for that connection issue. Yeah, so inclusiveness is something that defines a service, an organization, a community, and it indicates the capacity to take into account excluded or marginalized group. So this is a bit of an abstract definition, but if we look how it translates into humanitarian action, it means that us as NGOs or as civil society organizations, when we put into action a humanitarian response, we need to make sure that we take into account marginalized or excluded people or excluded groups. And this means that we need to put in place deliberate action first to identify these groups, identify these people, and then to strengthen their access to service and to their participation in decision making. So this is really something that we need to think about and to voluntarily put actions for this, and it starts with identification. So this is just a quick introduction, and so about this session on promoting inclusive networks throughout the data cycle, my reflection was how can information management contribute to inclusiveness? And these were my initial thoughts. So based on this data cycle, so when in the preparation phase, I think that we need to make sure that we are going to collect the right data in order to identify the population at risk of exclusion, because that's really the key point. If you want to be inclusive, first you need to identify these vulnerable populations, these populations that are at risk of being excluded. Then once you have identified them, you can start doing something. During the data collection step, I think that's a key point is to make sure that we are inclusive during these data collection. So use tools and processes that are inclusive, make sure that we are able to collect the data of all these groups of people that are maybe less visible, that are maybe marginalized. In the data analysis, something that we can do is systematically disaggregate the indicators by gender, age, and disability, at least, and depending on the context, some other factors might be relevant to identify maybe populations that could be excluded. And when we, in the final steps, when we share the results of our analysis of our work, we need to share it with the communities in an inclusive way, and we need to involve these communities in the decision making. So these were my initial thoughts about this topic, and all these we are going to now discuss a bit more with our panelists. So Rikke, I think you can start.
Yes, thank you very much, Florian. Could I just ask the moderator to put on my slides, please? starting from the beginning. So thank you very much. So first of all, I'd like to again thank the organizers for organizing this really interesting roundtable from the European Commission side. And I realize I didn't say that DG ECHO is, of course, a DG of the European Commission in Brussels, so sorry about that. But anyways, from the European Commission side, we very much welcome the theme of this year's Development and Humanitarian Forum. It is, of course, crucial to put people first in information management, but also quite tricky with the new digitalization and all of that. So it's really interesting. The focus also very much complies with the European Commission's focus on knowing more about the populations we serve in order to provide the best and most inclusive humanitarian assistance and protection possible. So today I will be speaking about the EU's and in particular EU's Humanitarian Aid Department, DG ECHO's commitment to gender, age, and maybe also disability inclusion in our policies and practices. What I'm hoping with my presentation is to contribute more with a global and overall perspective on today's theme, coming from a donor and also having the more overall perspective. I will leave the more technical parts to the other panelists that I'm sure and that I know are very skilled at this. So hopefully you will get a bit from my presentation as well. Just a bit of a disclaimer, since I'm quite not so familiar with the group, my presentation might not hit where you actually are in terms of understanding and everything, but I hope you will still follow. Next slide, please. Next slide, please. So why is this important to DG ECHO, to ensuring information management that is inclusive and for everyone really in the humanitarian community? Well, of course, it's about the humanitarian mandate. DG ECHO's mandate is specifically to provide assistance, relief and protection to victims of natural and man-made disasters. And we do this, of course, in line with the humanitarian principles. So of particular relevance for today's session is, of course, the aim of ensuring non-discrimination and of focusing on the most vulnerable. So translated into policy and practice, this includes a natural focus on gender, age, and people with disabilities, and of course other vulnerable groups. That is very important to mention, the intersectional focus. And this is, of course, in all steps of the policy cycle. Next slide, please. So just to give you a overview of relevant policies that ECHO has published within the last year that aim to ensure inclusion in the policy cycle. So firstly, I'd like to mention the gender policy from 2013, which provides sort of a framework for systematically integrating gender perspectives into the EU's humanitarian assistance. And that is, of course, to improve the quality and effectiveness of our actions or our partners' actions. So following this and to ensure implementation of the gender policy, we introduced in 2014 a gender and age marker, which is basically a tool to assess, promote and track EU-funded humanitarian projects and their sensitivity to gender and age. And lastly, also, I'm not going to talk about the protection policy today, sorry, but lastly, I would like to touch briefly upon the disability operational guidance, which we published just last year and which kind of spells out also issues of information management in terms of disability inclusion. I hope to be able to touch upon this, but I realize my presentation is a bit too long, so I may just focus on the gender and age perspectives. Next slide, please. Next slide, please. So just to elaborate a bit more on the gender and age perspectives, as most of you or all of you are probably aware, crises are, of course, not gender neutral. They have different impact on women, girls, men, boys, and elderly people. And there is a recognition from our side and as well in the humanitarian community that gender insensitive operations are just less effective. If the most vulnerable are not intentionally included, there is a high risk of not reaching those people, of failing to respond to their needs. And this is, of course, not in compliance with the humanitarian principle of non-discrimination. And also strengthening the gender approach is a commitment made in the European Consensus on Humanitarian Aid, which guides all of the work of DG ECHO. Also to mention that DG ECHO has a holistic point of view on gender. So of course, women and girls are considered most vulnerable or disadvantaged in many situations, but also men and boys can be disadvantaged. So next slide, please. We do support gender inclusion, both in terms of mainstreaming, including gender-sensitive needs assessment in all our humanitarian actions, which is what is most relevant for today. We also do targeted actions in order to respond to specific gender-induced needs that could be gender-based violence, medical care, psychosocial support. And then we also support capacity building in the humanitarian community, for instance, through our Enhanced Response Capacity Program. Next slide, please. So to touch a bit more upon the gender and age marker, which I think is quite important for today's theme, we introduced this, as I said, in order to ensure that our activities are effectively implemented in terms of gender and age. So it's basically a quality and accountability tool that measures to which extent EU-funded humanitarian actions integrate gender and age considerations. Next slide, please. So the DG ECHO gender and age marker uses 4 criteria to assess how strongly humanitarian actions integrate gender and age considerations. First and most relevant for today is the gender and age analysis and the sex and gender disaggregated data. Then we also look at adapted assistance, we look at preventing or mitigating negative effects, and we look at whether the programs ensure adequate participation by the right groups. Next slide, please. So about the gender sensitive needs assessment and analysis, which is 1 out of 4 criteria of the gender and age marker. We introduced this criteria because we consider a gender sensitive needs analysis necessary to make humanitarian assistance more sensitive to gender and age. So in the gender and age market toolkit, which I have right here actually, which is a tool that we provided for our partners, it's here, to ensure gender and inclusion. There are some guidelines on how to do a gender and age analysis. And basically these guidelines are about being aware of how questions are asked and by whom, which Florian also touched upon in his presentation. There's also a recommendation to adapt to circumstances, make use of existing knowledge, challenge assumptions, and to analyze capacities. So basically about being contextual about the support that you make. So as an example of this, when rescue teams arrived in the northern Rocky Highlands in Pakistan following the earthquake of 2005, they realized that all the women they met refused to board the helicopter that they brought. So this was because some communities there practiced honor killings, and then women were afraid of being killed if they boarded a male-staffed helicopter on their own. If a proper gender and age analysis had been made here, then there wouldn't have been that problem because we wouldn't have had all male staff in the helicopters. Next slide, please. So also part of the gender analysis is aggregating data by sex and age. So this data, doing this sort of helps the analysis move beyond simple count of households and average number of members or the total number of beneficiaries. And the sex and age disaggregated data counts towards the final marker. I did put that it can be difficult to collect this because of, you know, limited humanitarian space, also cultural problems, that kind of stuff. So we do, of course, take that into account. Next slide, please. So determining the mark in the gender and age marker then takes into account all 4 criteria, just to remind you that the gender analysis in sex and age disaggregated data was 1, and then we mark either and not available if the marker is not applicable. We give a 0 if the action barely integrates gender and age, and we give up to a 2 if the action strongly integrates gender and age. And just to show you the progress, because this is of course made for a reason. So the second assessment report published on the gender and age marker in 2020 showcases that in 2016 and 2017, 89% of all EU humanitarian aid integrated gender and age considerations strongly or to a certain extent. And I think it was only about 3 or 4% that didn't take gender and age into account. So summa summarum, this takes us forwards in terms of focusing on the most vulnerable. I'm not sure how much time I have left, but I did want to also talk a bit about people with disabilities. So next slide, please. Yeah, I guess you all know that people with disabilities are quite vulnerable in humanitarian crisis. We say that 15% of the global population has a disability, and this is likely to sharply rise in humanitarian crisis. And in spite of this, manners of delivering assistance and protection to people with disabilities in humanitarian settings have been up until now actually insufficiently adapted. So therefore DG ECHO has also made quite a point out of ensuring that EU humanitarian aid is inclusive within the past years. I guess we can drop to 2 slides. Thank you. I dropped the legal and policy framework, but you will of course be able to see the slides afterwards. Just wanted to say a bit about what we have done in terms of including disability considerations in our practical work. So in our HIPs, in our humanitarian action plans, it has been a requirement to consider disabilities in assessments that our partners make since 2018. Also about mainstreaming, it is now a requirement that all EU-funded humanitarian actions are disability inclusive. And in terms of global capacity building, the 2019 interagency guidelines on inclusion of persons with disabilities in humanitarian actions were actually supported by ECHO. Yeah, and then I wanted to say a few words about the operational guidance note that we made in 2019. I don't know if you can see me, but this also touches upon data information collection and analysis, and actually has a separate part on this. So just to say that there's a lot being done at the global level to implement the technical parts. So we can drop 2 slides, please. So in conclusion,
sorry. Oh, okay. You're
in
running out
conclusion,
of time. So if you
I'm also done now. I just wanted to say that DG ECHO works at all stages of the policy cycle to ensure inclusion in the delivery of humanitarian assistance and protection. Thank you very much.
Thanks a lot, Rikke. It was very interesting to have the point of view of a donor on this question of inclusion, and especially on disability, age, and gender. I liked the fact that you presented the marker that is used by ECHO. And now we are going to have a focus specifically on gender with Marie, who is going to talk about this topic.
Yeah, thank you, Florian. I will share my screen. Okay. Is it okay? You can see my screen?
Yes, it's okay.
Okay, perfect. Okay, I just put this on one side. Okay. So thank you, everybody, and thank you for this organization. It's very great to talk about this topic, because I think it's very important on the field to consider the inclusive perspective in data collection. So thank you, everybody. I will talk about risks and data protection protocol. I will talk about gender and sensitive situation on the field. I will try to moving fast because I have 10 minutes, so try to respect the time. Why are protection information and data sensitive? Because contains beneficiaries identifying information like name, age, gender, etc. Respect for privacy and dignity, because it's a right for all individuals. Contains sensitive protection information, of course, and individuals and communities sharing their information are trusting us, and it's very, very important, and because do no harm principle, of course. What are the risks for individuals in general and in practice? In general, you can find stigmatization from community, family, retaliation from perpetrator or family and communities as well, or armed groups, for example. In practice, physical, psychological harassment and abuse, prevention of freedom of movement, arrest, and in the worst case scenario, death. So it's very important to consider this risk when you organize a data collection on the field, of course. For the NGO, in general, loss of trust from the individuals, communities, access as well. And it could be lost funding and donors, reputational risk, of course, for NGOs. So we have to consider the different phases like collection, storage, sharing, and how to mitigate our risk on the field. This is a very important question for us when you provide a humanitarian response. So always collect the informed consent, of course, always conduct a risk analysis, and don't collect information if it could put a person at risk. This is very, very, very important. Of course, organize a data protection protocol, manage your paper file or electronic tools with care, like password, very, very careful regarding emergency procedure like evacuation part. Only share information on a need-to-know basis. Always ask yourself, does this person need to know about this? Of course. Does this person need all the details to the protection incident, for example, like victim's name or other very tricky information? What information do I really need to share? And sharing with precaution, like with a password databases, coded data, partial information, use data protection protocol with third-party agreement, and be mindful. Limit who you put in CC in your email. Don't discuss work with colleague and friend if it's not necessary. And like we said, it's better to be too cautious than not enough, because it could be really, really, you could put the person at risk, and the worst case scenario is a death. So we have to be really careful. The storage, of course, sensitive paper files are stored in locked cabinets separating identifying name, and staff with access to locked cabinet are clearly identified. It's not all of your staff you should access to this information. Sensitive files are marked with a color code system. Closed envelopes and suitcases are used to end transfer document, for example. ID and personal document of the data subject are never held by, for us, for PUI or other NGOs or staff representatives. Consider the electronic data security, with data security in the field, with IT equipment. In case of emergency situation, closing up the office, it means country office have a clear shame of delegation in case of evacuation. Evacuation plan includes take, leave, and burn. This is 3 action points. Responsibility for paper file security and electronic file security are clarified. It's very, very important for this part. Informed consent, it's one mitigation measure to avoid to put the person at risk, but it's mean approval by the participants for the information to be used as explained, and it takes time. We have to provide details of the potential risk and benefits for the participation in the process. It's very important to understand that and expose clearly what can be the risk for the person. I will talk about gender focus, and it will be complementary with a complementary topic with my colleague from ECHO. I will try to add just the field perspective, maybe. Inclusion for data collection in the humanitarian response, and especially for gender and feminist approaches, is meant to ensure that preserve women's hard-won pre-crisis gain and the girls. And we can see this, this specific part with COVID response, for example, on the field. Achieve desired results for girls, women, boys, and men, their family and communities, reaching marginalized or vulnerable groups in particular, ensuring and building resilience, bringing pre-existing gender inequalities. And why? Because gender analysis examine the impact of emergencies on women, but not only on women, girls, but men and boys as well, and ensure that the humanitarian response addresses their distinct needs and priorities, like access to health services or healthcare services, for example, or mental health services. We have to propose sex and age disaggregated data, ensure effectiveness. Sex disaggregated data must be collected and analyzed to provide data for programming, of course, and sector need to determine which age groups are relevant for their programming. But I will not go into deeper because my colleague did it very well. What is gender analysis? I think really it's a foundation for good programming. It's examine the relationship between women, girls, men, boys, and take into account their respective roles, access to and control over resources, and the constraints faced by different groups. Gender analysis should be integrated into the humanitarian needs assessment and all of sector assessments or situational analysis and throughout the humanitarian action program cycle. It's allowed to better understand the population groups affected by the crisis, their needs, and the action they can take during recovery. Integrated gender aspect into your work improves your results, your method, and finally, the effectiveness with which you work responds to the needs of those affected by emergencies, especially for the most vulnerable people. The rapid gender analysis, the tools, I will not go into deeper for that, but it should be used by all of the actors on the field because it's an important tools to provide a good gender analysis on the field. And my last point, when you have to work on sensitive context, you have to propose a data protection protocol and propose a very sensitive one. I will take the example of DC detention center on Libya, for example. When you work on Libya, it's very, very, very sensitive to organize a data collection because you can put some person and migrants at risk, death risk, so it's very, very sensitive. How to mitigate that? This is an example of ethical deliberation step framework, what kind of data you should collect or not, and how you can do that. You have to examine arguments, define options, weigh the options, elaborate decision, justify decision, implement the decision, monitor and evaluate the outcome, and make the recommendation for future actions. If you cannot be able to collect this data, you shouldn't go on the very sensitive fields because it's clearly sure that you will put the person at risk inside your intervention. This is the rest of the framework for ethical deliberation. I will pass. So This is data collection methodology and objective, for example, in DC Center, in order to gather information on a regular basis on protection environments. Monitoring at the place of detention is conducted through a set of different methodology. So observation site visit, for example, other sector will be involved, like health or MHPSS, not only protection sector. Secondary data review, individual information, and data collection and analysis methodology is everything. Observation site, it's one of the key in DC Center in Libya to have access to data collection situation, of course. Other sector data collection methodology, I will not go into deeper. And I think it's very important to understand in this kind of sensitive environment, the data collection could be very, very a risk situation, and respect all of this process is ensured to not providing harm to the population. Thank you.
Thank you, Marie. It was very interesting. Also, thanks for sharing your field experience on this topic. I think it was much appreciated. Because we are starting to be a bit ahead of schedule, Dan, I'll let you present.
Sure, thank you. I'll just get my screen up. Okay, so shout if that's not come through. Oh, if you can't hear me. So yeah, just again, I'm Dan. I'm at Integrity Action. We are a small UK-based NGO working at the moment in about 8 to 10, depending how you count, countries in Africa and Asia. And for today, I'm focusing, or I've titled it anyway, mobile data collection. We're not a tech for dev kind of organization or anything like that, but we do have a mobile app that is quite used in all of our current programs. Not to say it will always be in future, but we have a lot of experience there. And again, of course, this whole panel is on the whole data cycle, but yeah, others have touched on other parts, and I know Jerusha coming after me will focus very well on what to do once you've collected your data. So that's what I'm focusing on. And yeah, it's good to think about kind of why data is being collected and for and what context. We're talking about what kind of data we're collecting. So in the context I'll be talking about for Integrity Action, actually we're not talking about monitoring, evaluation and learning data really. So within MEL, and just to be crystal clear, I'm sure people know this, within MEL you often think about the set of actors going from potentially a program donor through kind of a program implementer maybe, to the people it's working with in support of some kind of public good, and you do monitoring, evaluation and learning at all of those levels. It's not an upward flow, but you do it at all those levels to see how it's happening. That's not the kind of data collection that I'm really talking about in this presentation. We're looking at a different set of actors. So that may be the funders of that public good, that may be the local government, for example, the Ministry of Health. And the data being collected in our context is actually collected by the citizens about the public good and feeds into the decisions that affect their lives, and we support them to do that. So as mentioned, we have an app. Our app is called Development Check. You can find it on like the App Store and Play Store and everything, but it's not. You would need an account to be able to log in, and you'd need to be part of our program, so it's not kind of an open access thing. And I'm not going to focus too much on it. There's a screenshot there for those who can see. For those who can't, it's a very simple multiple choice question. In this case, I mean, it's a random screenshot. But the woman may be here monitoring the construction of this borehole that is meant to be being built in her community. So she's got the app and she's using it to report whether the construction is is kind of going appropriately. And that's the kind of data that we may be looking at. It may be construction, a lot of it would be service delivery as well, education or health service delivery, but that sort of context and that sort of data. And the data, just to say, like I say, I'm focusing kind of on the collection side, but in terms of where it goes, as soon as the woman in this case would just click submit, it goes live to our website, and if you go to integrityaction.org, you can find it all. So there's that. Let's kind of get on to the focus, inclusion. I think Florian's introduction to this session was really good to kind of think about what we're talking about by inclusion. When I was thinking about this, I mean, for me, inclusion and participation go together. It's hard to talk about one without the other. Otherwise, it's a case of, you know, inclusion in what, or if you're talking about participation, talking about whose participation. So inclusive participation is kind of what we're aiming for. As I said, we're trying to bring the voices of citizens into decisions that affect their lives. That, I think, is already quite inherently a step towards inclusion. Of course, intersectionality and all that means that there are certain groups whose voices are least likely to be heard, and others in the panel have covered that more than I probably could in terms of like gender, age. I definitely could gender, age, disabilities, and so on. Just to say that in terms of our app, for example, there's about 450 adult monitors we have using it at the moment, and about half of those are young women aged 18 to 34. So we have, as I mentioned right at the beginning, we have a gender, we have a social inclusion strategy, and it's quite inherent in our work. But for the purpose of this presentation, really I'm thinking about inclusive participation. This you may probably all be familiar with. I mean, it's pretty old, Arnstein's ladder of participation from the 60s. And we know that to kind of move participation up the level from kind of non-participation through kind of consultation, application, up to kind of citizens actually having power, there are barriers at each level. The barriers may be different for different groups at each level, and you've got to tackle those in an inclusive way. So some of the things you have to tackle, especially with technology in our approach, accessibility issues. So within tech, our app is a smartphone app. Obviously, that immediately excludes people who don't have a smartphone. So we provide them. As I say, this isn't really it's not something that we just expect people to go on and download. We provide the phone. We also provide training on how to use a smartphone, because of the context we work in, people haven't used one. They need training even on, you know, taking it out of the box, charging it, that kind of thing. Training could follow all of my bullet points from now on as well, but I won't in the interest of time. And obviously, again, not just data collection, but in any context, training itself has to be done in an accessible way, which means thinking about the language, thinking about the venue, the time, all of that kind of thing. Language is obviously an accessibility barrier, so our app is available in all local languages that it's used in. Text to speech or speech to text is obviously an advantage of tech. It's something where tech can actually overcome a barrier. Our app is compatible with standard software like that, and that can be a benefit. Working together, essentially nobody uses this app by themselves. Our monitors work in pairs, so our model would be that we train a bunch of community members who choose actually what to monitor, but they will work in pairs. So that makes it more open again for those who may not physically be able to use the app for a disability reason, for example, or who may not be literate, and that kind of thing. But also just to recognise some barriers to inclusion you won't actually be able to overcome in just by giving tech in some contexts and cultures. For example, women aren't really allowed to use phones. That's something that needs addressing. It's probably not something that's going to be best addressed by just kind of going there and giving them a phone. So something to work on, but just to recognise there are limitations, but there are other ways in which excluded groups such as that could be involved. So within our programmes, tech isn't the only part of the programme. We do have wider working groups. They could be involved in data validation. They can feed in through community surveys and other things. Data quality. This can be a barrier to inclusion because people may think particularly because we're talking about including people in doing the actual data collection. Some people dismiss that by saying, well, these aren't professional social researchers. How do you make the process open but still give you good enough data that it's worth doing and you're not just wasting everybody's time? We have quite closed questions, so multiple choice, quite defined questions. We used to have a kind of a more open thing where the people using it would have to categorize their answers themselves in quite an open way. That was quite difficult, provided a higher barrier to entry. So we now actually have it's more automated. Responses are linked automatically to problem categories and so on. But importantly, those questions are developed in an open process. Tailored to each context, we work with the people who are going to be collecting the data to decide what questions they're asking. You have to know when to adapt to unexpected use. This tool is meant to be for citizens to raise their voices. So if they want to use it in a certain way, we let them. But in other ways, we don't, because there are some things that are important around data sensitivity. For example, as I said, the data does go live to the website. Photos don't. We have a check on that. Knowing limitations. This is related to the above, but also, just not kind of asking them to ask very sensitive questions. So the people who are doing this, our monitors, we ask them Washington Group questions on their disability, but for when they're using the app to survey their community members, because we haven't been able to train them all in doing disability sensitive conversations, we actually just kind of have a more self-identified disability question in there. There are issues of safety and safeguarding. I realise I'm already kind of approaching the 10-minute mark, so I won't go through these as much. Just to say again, the pairs thing helps. We have a functionality on the app where if anyone's got a concern, they can report it either to us or to one of our local partners. The app is part of a broader process. It's not a kind of secret mystery shopper that kind of sparks, conflict between the citizens and the people they're speaking to. It's not exactly a kind of truth to power thing. It is a working together thing, and we think that's quite important, particularly because the people working with, and certain groups within that may be more at risk of reprimands and other things. And COVID-19, of course, is something that needs thinking about. This isn't a remote data collection thing because people using the app, still moving around, talking to people. It would be very unethical for us to kind of treat it as a remote thing just because I'm comfortably at home here. So there's that. And this is my final slide. So I'll just wrap up with my 3 points. First is that, as I mentioned, just including data, just disaggregating data isn't inherently inclusive in itself. We need to think about what we're including people in. Is it meaningful participation? Data collection, I mentioned right at the beginning that I was talking about this end of the cycle, if a cycle can have an end. But I think, again, Florian's slide at the beginning was really helpful in kind of putting collection in the middle. There's all the bits to do before, identify the data you're going to collect and plan for it, and you've got to involve the people and think about inclusion at that step as we do. And tech isn't going to solve all your inclusivity problems, just in case anyone really thought it was, but it can help. Hopefully I have, in my slightly overlong talk, mentioned some of the ways in which it can help. I'm happy to answer questions about that later. But yeah, thank you. That's a bit of a whistle stop. But, back to you, Florian.
Thanks a lot, Dan. Very interesting, and I would love actually to test the app one day. Okay, and just to conclude the presentations, and then we will go to Q&A, but just before, Jerusha is going to talk about data sharing and communication, which is, as she said, her favorite topic, if I understood well.
Thank you. So yes, given that I'm the last speaker on the panel, I am focusing also kind of at the end point in the data value chain that I'm going to refer to, or the data cycle. yeah, depending on how you look at it. And what I want to focus on specifically is really on inclusivity aware data analysis and communication, and sharing some examples from my experience at Data Innovator of how we've attempted to improve or promote inclusiveness in our data work. Just a quick one on who I am. I've already introduced myself, but this is a pic of my small team based in South Africa, and our details are below, so feel free to reach out or follow us on Twitter. But our work at Data Innovator is really around helping organizations tell stories with data. And we do that through our innovative analysis, visualization, and communication. And hence, this is the same data value chain that Florian had shared, that we also use this kind of as our guiding light. And there are many data chains, data cycles, and variations of it. But what I appreciate about this value chain that's created by Open Data Watch is, as Florian had said, it really emphasizes the use aspect of the chain, that it links the production and the steps required in data production. It highlights that there is a clear impact point and there's a clear purpose for all the data. So what I'm going to speak to is really this kind of point around the publication and how we can consider promoting inclusion at the point of publication, which is when we're analyzing our data, once we're thinking about the release and how we disseminate it. And so there's a bit of the production phase as well as thinking about the use of it. And this could be the use by beneficiaries, key stakeholders. How do we ensure that that has been considered in this point in the data value chain? But to start, I really unpacked, and I think Florian also unpacked this really well in the beginning, like what does this mean? What does it mean to be promoting inclusion in the data cycle? And I looked specifically at what does it mean to promote inclusion when we're thinking about this from an analysis and a data communication perspective. And to me, it's really around setting intentional efforts in our analysis and our data communication that ultimately is avoiding exclusion. And this is exclusion of individuals, groups, beneficiaries, through the way we've incorporated representativity and accessibility in analysis and communication. So then I unpacked this a bit more and looked at, okay, so then what does it specifically mean from the analysis side, which is really around ensuring that you've put in place certain practices in your data analysis that allows for the interpretation that's not exclusionary. And this could be either in the data itself, in how you've analyzed it, the data that you've collected. It could be in the meaning that you've drawn from it. And it can also be in the process of how you've analyzed it. From a communication perspective, it's really like, how have you presented it in a way that does not exclude? And I know that, what I really liked about the HI model or the definition is that it's got exclusion, segregation, and these various other. So I'm going to borrow from that. It's not just about exclusion, but it also avoids the segregation and the other terms that were included. And from a communication perspective, it will also be around how are you presenting the meaning in an inclusive way? How have you considered who's actually meant to read that information or interpret it in a manner that's inclusive? And also, how have you thought about the emotion that it provokes? Because that also can be exclusionary if you've designed it in a way that doesn't account for that. And that really brings us to thinking about, how do I take this and actually create practical ways of ensuring that I've taken into account inclusivity-aware analysis and communication? I'm going to share some examples. I mean, I could share many more, but I'm just going to share one of each so that you have a sense of how we've considered this and what else can be done. So from the analysis perspective, the first is in the data. And already my colleagues have spoken to this, that just by considering what we aggregate and disaggregate is a really key step in analysis to ensure inclusion. So this image is something that you might have been familiar with, where it's just random data, but often a picture that I've seen where we aggregate information by certain gender categories that may not be relevant to the context. So it's really important that in the data analysis process, we've also considered what are some of the nuances, and have I incorporated this in my analysis to ensure that I've taken into account how this will actually influence program design. And lastly, I've taken into account the adequate quality checks and balances in the data that I'm analyzing to ensure that actually the insight I generate will be, fit for purpose. Then looking at inclusion or interpretation, data analysis and interpretation that does not exclude in the meaning. What is really important at this point is that when we're going through analysis, really ensuring that you've taken into account what is the contextual information that will support what I'm analyzing and presenting that to make sure that your assumptions are appropriate and the interpretation is appropriate. And on the left, you'll see there's a little headliner from a news article, and it states Botswana's High Court rejects laws criminalizing homosexuality. This was published in 2019. The reason I'm sharing it is because this kind of represents a story or an experience I have had in making sure that we source the right meaning before presenting or analyzing our data. Is that I worked on a project some years back in Botswana, and it was a USAID funded project. And so they had specific disaggregations on MSM, who is men who have sex with men, for their key populations. But at that point in time, homosexuality was criminalized. It was before this rejection of the law. And so when sourcing information, we've obviously found that we had really low numbers related to MSM. But without having that contextual insight as actually, because of the criminalization of homosexuality at that point in time, it would affect what individuals are willing to report and how we interpret and use that information. And so we really need to have that additional insights to generate true meaning rather than analyze and read the number as is. And then in your analysis, it's also important to consider how do you ensure inclusion in the process of analysis, that it's not a step of analyzing and handing over information, but actually you've included representatives of stakeholders. This could be community members, even the funders, that they are part of the process of analysis and interpretation. It also helps build ownership of the information once you get to the point of dissemination. And it ensures that you've actually validated and filled some of the exclusion gaps, giving you the full kind of context as well. In the picture, you'll see I've shared one example of a really great resource to think about how do you practically do this. We often use sense-making sessions, collaborative sense-making sessions with participants, so that once we get to preliminary analysis, we sit together and we practically talk about what it actually means without us, from a technical perspective, trying to interpret it before getting the insights. But the book I was referring to, it's by Jean King and Laurie Stivan. So it's called Interactive Evaluation Practice. It's a great resource to look at what are some of the kind of practical methods to ensure interaction with different stakeholders in the analysis process before you get to the actual publication or the presenting of the final info. And then looking at it from the communication, the data dissemination or communication point. And as I indicated, the three areas that you can think about inclusion at this point is in what you're presenting in terms of the meaning that you're conveying in your presentation, who is accessing it, and also the emotion that you're evoking in it. And so the first is that making sure that actually your presentation doesn't exclude in its meaning. Have you ensured that you have the relevant supporting information to create a complete picture when the reader is looking at it? These are things like sample size, description, having contrasting quotes, not just the positive quotes. But it also is around considering the design sensitivity. And this is, for example, like, have you used the appropriate color and icons for interpretation? One common, poor use of icons is the use of icons to represent disability. What I like about this little sample in this picture is that at the bottom, you'll see there are several depictions for disability, but often individuals might just use the icon with an individual in a wheelchair, which is not inclusive. And it also skews our meaning when we look at that kind of presentation of information next to that picture. Even the use of color, because we have assumptions around what red means, or green and red means good and bad. By using those color shifts the meaning as well, and we need to be conscious of how we're using that. The other aspect to think about is even in design, when it comes to considering your audience and whether you have a colorblind audience or not, that needs to be taken into account. And then related to that point is presentation that does not exclude when thinking about who your audience is. And often you will have more than one audience. You might have the funder and we present the details report for the funder, but actually how are you presenting and packaging the information that's going to speak to the beneficiary in the community, the program manager in an NGO, which means that you do need to think about the format that speaks to that audience in order for that information to have an inclusive way of communicating it. Could be in the language that you've used, making sure that you've translated into the relevant languages, the format. So in some cases, like on the left, you'll see there's a nice CDC summary infographic that speaks to a certain audience. It's saying, giving them just 3 pieces of data and an action at the bottom. But would that make sense for somebody in a rural location? You wouldn't necessarily be emailing an infographic with some actions to them, but maybe you need other mechanisms or other tools, a print-based one, a video-based one, a recording one. And then that's also related to the medium that you use then to actually channel it. And then lastly, thinking about how do I make sure that that information actually reaches the individual. You can have a beautiful infographic or data viz, but actually the individual in the community, how do I get that to that community if it means delivering it, conveying it in a certain way. And then lastly, looking at presentation that does not exclude through the emotion it provokes. And this is something that has recently become a bit more alarming or clear to me, in that sometimes we often, especially in data viz, we use design elements to enhance how things pop out. And I found, especially with COVID-19, there's been a lot of visualizations that have over-sensationalized information and created fear or desensitized individuals to the actual value of the data or the purpose. So by doing that, it hinders me from actually interacting with the information, asking questions about what does this mean? Why has it gone up? So the little picture on the left is an example of this is from the Western Cape. So in South Africa, the Western Cape province had really a high spike in COVID cases during over the past months. And they had a series of visualizations with these big red bubbles. And you'll see even with current deaths, there's a gravestone and flowers. And this is for a public audience. But the kind of effect that you have with this kind of information is that the public audience is more alarmed and afraid than posing questions and asking, what do I do with this? What do I change? So we do need to be conscious around how are we ensuring that actually we've taken into account the emotive value or the emotive presentation of our data as well. So these are the key considerations that I wanted to share with you around thinking about inclusivity, aware data analysis and communication. I'm happy to take any questions. Here's our contact information if you are interested to connect or hear a bit more about Data Innovator. Thank you.
Thanks a lot, Jerusha. That was very interesting and very concrete. I really liked the examples that you showed. Okay, so that's all for the presentation. So we are a bit late, but we still have 20 minutes for Q&As. So please don't hesitate to write down your questions either in the chat or, if possible, in the Q&A box. That's even better. So right now we have one question from Chloe. She asks, seems like NGOs thought about how to promote inclusiveness from their sides, but what about inside these sectors and between actors? Do you find NGOs are exchanging, debating enough about these solutions? So I'll try to answer to that, and of course, for everybody else, don't hesitate to complete then. So I think that it's something that starts to work. Indeed, inclusiveness is something that is quite new for a lot of NGOs. That was maybe not something that was really debated still 5 or 10 years ago, but it starts to come into the debates. And what I've seen is that at least maybe French NGOs are not so much into that yet. But if we go in England, at least in the Anglo-Saxon NGOs, I think it's really a topic that is debated, and I've been to several conferences in London really debating this about inclusion in humanitarian action. So I think it's really, it starts to grow, and I hope that in the coming years it's going to be a real big topic and not something limited to some maybe specialized NGO, but something that everybody is talking about. I don't know if some of you want to share. Yes, Marie, please.
Yes, maybe just to add one specific point, but the Global Protection Cluster and Interagency Standing Committee organized many sessions, webinars on the subject. They try to coordinate markers and methodology used to ensure sector harmonization in terms of inclusiveness, but to go further and to ensure that it's not only a donor constraints, but a real sector awareness and a need in the field. Indeed, we should go further, I think. Yes.
Yes, and thank you for that. And I take this opportunity to add that the Interagency Standing Committee guidelines on inclusion were released, I think, last year. So that's really a key document if you're working on inclusion, and that's something that really goes into this idea of sharing good practices and having some common grounds about around inclusion. Jerusha, I think you wanted to.
Yes, I wanted to respond to that as well and say that, you know, particularly from the South African perspective, I think that associations have really been the drivers of debate. So we've got like the South African M&E Association, Evidence, the African Evidence Network, and those have been the places where often NGOs or evaluators and, you know, evidence producers come together and talk about inclusion. But I do feel like it's still at an early phase, and it's mainly like dominant in education and health sectors and not really across all sectors yet.
Okay, thanks. Any other question? Okay, Jerusha, we have one for you. Could you please share a story experience on leading a sense-making process with groups having what we would call traditionally low data literacy level? What was the process?
Yeah, that's a good question. And data literacy, so in the work we do, we're quite intentional about building data literacy skills and then doing the data work with the team, the organizations we work with. So what we've done is that, for example, if we're running evaluations or working with organizations, we've got a program called, it's a data artistry program, and it's really like entry, maybe not entry, but, you know, beginner level into data communication, understanding data. And so we usually provide capacity building to the entities or individuals that we know have a lower data literacy. So at the point of providing information, we've boosted their capacity and then can have those sense-making sessions. So often that happens at the beginning, that we'll run a training on data, we'll then do our data collection, analysis, and then sit together and then talk to the information. So it's not completely new. But I must say, I mean, most of the cases, the data literacy of the people we've worked with has been at a fair level. But we also have looked at like more creative ways, such as with the Laurie Stevan book, where in groups with low literacy, you can find kind of metaphorical ways to talk about the data. So like using quotes and then having pictures to talk about, you know, which picture represents what this quote means to you, so that we find channels to talk about data in a not very technical data way. And that's how we can then collaboratively, like, have a set of questions that we need to ask, like, what does this mean? What are the underlying factors? But then have tools like, here's a piece of information and this is what it says. Choose a picture that then tells you about what this means in terms of your context has influenced it. So that's some ways, the training, and then looking at creative methods to talk about the data during the sense making.
Thank you. Any other question? Yes.
Okay, I have a question for Dan. If that's okay, I can just verbalize it.
Of course.
So Dan, you mentioned that it piqued my interest when you spoke to the point that sometimes, you know, you need to use the working groups in cases where a tech solution is not an appropriate way to ensure inclusion. I wanted to hear a little bit more about what are some of those non-tech working group solutions that you've had to implement.
Sure. So all of our programs actually have what we call a joint working group. They may have other names within the sector as well. So typically, what they would look like would be a combination of the monitors who are actually using the app, some of the duty bearers who are delivering the service or project that is being monitored, possibly a member of one of our local partners, CSO or similar, and other community members, possibly other local authority figures as well, who may not be the ones directly delivering the service. And they would meet kind of on a regular-ish basis. I mean, it varies between programs, maybe once a month or so, and they would discuss the problems that had been captured and reported by the monitors who are using the app, and they would also try to understand the causes for the problems, because obviously in a lot of cases, the duty bearers who are delivering the service, they want to be delivering a good service, but they're not getting the resources or the backing or the funding from higher up the chain that they need. So it's good for the community to kind of understand that and understand where the blockages are, and they can work together on solutions which can take all sorts of forms. Those groups, the selection of them can be is done in different ways. In different programs, but usually some element of local election, as there would indeed just with selection for monitors in the first place. So that's one thing. I mean, another kind of non-tech sort of adaptation, which is, as I say, that's in all of them, all of our programs, and it's probably more fundamental to the process than the tech is. But kind of an adaptation to kind of a replacement of the tech would be. I mean, I was only really speaking about adults using it. We do actually have programs that work in schools, and we've got about a few thousand anyway, secondary school students that we work with in integrity clubs. I didn't mention them because it's a bit different in the way that they would actually be monitoring anyway. But in some contexts, they do still have a phone for the club. In other contexts, so in Nepal, also in Afghanistan, I think they're kind of not allowed to take a phone into the into the school for valid reasons. But in Nepal, they've kind of created a system where they have like a poster sort of system up in the school, and it's kind of got traffic light systems. So it's got a list of different topics, the kind of things that they would be looking at through the app, on kind of the school infrastructure and the quality of teaching and whether the teachers are actually showing up and that kind of thing. And they'll kind of have a traffic light for each of those, which then everyone in the school can see and discuss.
Thank you.
And Isabel in the chat is one of my colleagues and is posting.
I think we guessed. Thanks for sharing the links. Anybody else? I don't see any other question in the Q&A or in the chat. We still have a few minutes left, so don't hesitate.
Yeah, I mean, just maybe while people are still thinking or typing questions, just kind of go back to Chloe's question about inclusiveness within the sector. Maybe that was answered to her satisfaction anyway, but I think it's quite a big question. So it kind of depends what how big a question we want to talk about it. Is the sector inclusive as it should be? No, it's not. There's still a gender pay gap. That's unacceptable. We have Charity So White and things like that, campaign groups with very valid concerns about inclusion in the sector. There's a lot of things that need addressing. But specifically to inclusiveness within the data cycle, data collection, I think kind of working between organisations, there's a lot that happens, but a lot of it happens at sort of HQ level. It happens in London. It happens, I suspect, in other kind of countries within the global north where kind of big INGOs have their bases. So I was part for a while of a working group in London led by Leonard Cheshire Disability on how to collect disability data, for example. There's also all the bond groups in London. Again, that's a UK kind of network of things. So I have a lot of those conversations with other charities, but how much that translates, you know, into kind of the countries where we work. Yeah, I would say it doesn't enough. I mean, Integrity Action, we don't have country offices. We only work with local partners, and we do discuss things for those. But yeah, certainly, so big INGOs that have country offices and you know, and a HQ office. I certainly think there's a big gap in terms of the people in the country offices actually being able to engage in these kind of debates, and also different different social norms in some contexts around inclusion and issues like that. So yeah, definitely a lot more to be done.
Yeah, true. That's right. What you mentioned, that this discussion right now is happening mostly at HQ level, but not necessarily on the field. Even if, for instance, HI, that's really something that we are trying to push and to have also these discussions at field level. But it's true that it's something that's not really so much done right now. Okay, I don't see any other questions, so if no more questions, I think we can close this session here. Oh, okay. I cannot pose questions, but I have one coming. Okay. Are you aware of any interesting resources that could serve as checklists of the aspects to consider throughout the data cycle for more inclusiveness? I don't know if we have. I think the YASC guidelines on inclusion that we mentioned could be a good start for this. Yeah, so now the question is in the Q&A. Yeah, so my initial thought would be the YASC guidelines, but I don't know if some of you have other resources that you want to mention.
I just put it on the chat.
Yeah, thank you. Okay, so I see that nobody has any other answer.
Actually, I can go, Florian, because I would promote our operational guidance note, which actually includes some of these considerations. I can also forward a link to that.
Yeah, thanks for mentioning. Can you put the link also in the chat? I think that would be helpful.
Sure, I'll do that.
Okay, thank you. I don't see any other questions, so I really want to thank everybody, all of our speakers, the Car2NG team that helped us facilitate this session, and of course, all of the participants for your interest in this session, for your questions. I've learned a lot from your interventions. That was very, very interesting. So thanks, everybody. And well, I hope to see you soon in other sessions. Bye.
Bye-bye.
Thank you.
Thank you. Bye-bye.